Hello everybody and welcome. This is Andrea Twarowski here with Dentalelle Tutoring. I'm pretty excited because this is officially video one of something new that I'm trying. So what I want to do is I want to go over some mock exam type questions for all of you in a video. So it's not going to be long. It's going to be about 10 minutes where I want to start to do this on a consistent basis where I'm going to just be going over some mock exam type questions together. You can listen to this while you're at home having a coffee. You can listen to this while you're at home getting ready for school in the morning, while you're doing the dishes, while you're cleaning, whatever. But you can listen to this while you're doing something else, and it's like you're studying at the same time, but with me there with you. Yay! So I thought that this might be a fun thing to do, and this applies to both dental hygiene students and dental assisting students also. So what I want to do is I want to go over, I'd say about 5 questions. That should be about 10 minutes. And I'll discuss the answers with you guys after each question. So I'm going to read a question out. I'll give you guys like 20 seconds to think of the answer, and then I'll give you guys the answer and tell you guys why it's the best answer. So it's kind of like we're having a study session together. And the best part is that I want to do this on a consistent basis. So I'm thinking once a week, twice a week maybe, something like that. So you have something to look forward to and you can get at least a little bit of studying in while you're doing something else because you'll be able to hear me talking. You don't have to be watching me like if you're doing something else, but at least you'll be able to hear me talking. What was I going to say? So the videos are going to be about 10 minutes. And if you have any questions, just feel free to email me too. I'm going to post the videos on YouTube. And if you subscribe to my YouTube channel, I believe every time I post a new video, you will get an alert that I posted a new video. Now, I don't know exactly if I'll be doing this every Sunday, every Tuesday and Sunday, or every Wednesday and Friday. I'm not sure yet. So I do think that that's a good idea for you, that if you subscribe to my YouTube channel, then every time I do post a video, you will get a notification that a new one's up, and then you can hear some new questions. Why not, right? So anyway, so let's get started. So I have some questions here. And what I'll do, as I said, is I'll go through the question and then I'll give you guys 20 seconds to think of the answer and then I'll give you guys the answer. So let me just have some of my latte here. Yum, yum. So good. Okay, so are you ready? So first question is, the route of administration for drugs which enter directly into the lungs is known as A, intramuscular, B, inhalation, B is inhalational, C is intravenous, and D is intraosseous. And what I suggest to my students to do who are part of my full board exam prep courses, where we do this for a lot longer, and we do it every Sunday or every Saturday if you're a dental assisting student. But what I tell my students is before you look at the answers, read the question and then think of the answer in your head. Because at this point, you should have an idea of what the answer is. But if you're really not sure, then look at the answers and then decide which answers it can't be, so which ones it's not, and then do process of elimination and pick the one that is the best one. So I'll let you guys think of that, so I'll say it again. The route of administration for drugs, which is entered directly into the lungs, is known as... And the answer is inhalational. So that is B, I believe. Yes. So that's the answer, and that's the best answer. I don't know how else to explain that to you because it couldn't be any of the other ones because this is specifically entering directly into the lungs. So a way to think about that is inhalational. So you are inhaling something. So even if you didn't know what the answer is, you just have to think about that and then look at, I guess, lungs. So how do lungs work? You inhale and your lungs expand. You exhale and your lungs become smaller. So then look at the answers and think, well, what could that be? So inhalational is the answer because it's part of inhaling, and that is what you have to do when you're thinking about the lungs. If that helps, I hope I didn't just confuse you guys further, but I do hope that that helped. So next question. So question number 2. So patients who indicate on a medical history that they have rheumatoid arthritis most likely take an anti-inflammatory drug known as, and the answers are A, nitroglycerin, B, atropine, C, aspirin, and D, amoxicillin. So this one is a pretty easy one, I must say, because even if you're not sure, think about which one of these is an anti-inflammatory. If you're really not sure, then go by process of elimination. One of these answers is an antibiotic. So that's not an anti-inflammatory, that's something else. So if you know which one's an antibiotic, you can cross that one out. Just something to think about. So I'll give you guys a second to think about that, and my coffee's getting cold anyway. Yeah, it's been sitting there for a bit. It's a little bit cold. So the answer is C, aspirin. So aspirin is an anti-inflammatory. So that is why this is the best answer here. I can't think of any other way to explain this, but that is something that those patients are on typically. It could be a half of an aspirin, it could be a full one, but because it's an anti-inflammatory, this is the best one to be on. Advil is an anti-inflammatory as well, but I guess it's more severe, for lack of a better word, than aspirin is, so that's why that wouldn't be a good answer, but Advil is not in here anyway. So are you guys ready for the next question? So question 3. So symptoms of cardiovascular or cerebrovascular incidents include all of the following except A, weakness on one side of the body, B, chest pain, C, labored breathing, and D, arrhythmia. So what do you guys think? So all of the following except. So you do have to know what all of these mean. So I guess they're pretty self-explanatory except for D, arrhythmia. You have to know what that means. So arrhythmia technically means redness. On the board exam, if there's a word that you don't know what it means, depending on the type of word, you could ask them a question and simply say, like, I don't know what this means. But in this case, since it's more of a healthcare term, you not knowing what it means, they probably wouldn't help you. But if it's something like in the question, you don't understand what the question's asking, then they might be able to help you with that. But anyways, I'm sorry. So what do you guys think the answer is to number 3? So the answer is D, arrhythmia, because arrhythmia means redness. And redness has nothing to do with the cardiovascular or cerebral incidents, but everything else, yes, it does. So it could be a sign of that. I think 10 minutes is almost up. Wow, that was fast. How about we go through one more question and then you guys are all set. So question number 4, which I like. Which of the following is recommended for the prevention of an asthma attack? Prevention. An asthma attack is the key word here. So A, a bronchodilator, B, ammonia vaproles, if I'm saying that right, VAPOROLES. So I hope I'm saying that right. C, blood pressure equipment, or D, an automated defibrillator. So what do you guys think number 4 is? So which of the following is recommended for the prevention of an asthma attack? This one I feel is simple, is very, very easy. So in all honesty, if you don't know this answer, you need to study, I guess, your pharmacology section or your pharmacology unit, because this is the easiest, I think, type of pharmacology question that they would ask you. And if it helps, at dentalelle.com, I do offer mock exam packages per unit. So I have a mock exam package for oral pathology, one for pharmacology, one for community and case studies, one for special needs, so on and so forth. So if you find over these videos, if there's a consistent, I guess, topic that you keep on getting the answer wrong at, go to dentalelle.com and have a look at the mock exam packages, because what they are is it's a full package of only mock exam type questions for that topic. Plus, there is a separate PowerPoint document to help you study for that section. And for the mock exam, it includes answers and the rationales also. So it's pretty awesome. So if you need extra help, then by all means, have a look, because it is extremely helpful. So anyway, so number 4. So what do you guys think? So the answer is A, of course. So a bronchodilator helps to prevent an asthma attack. Let me think. I don't know how else to explain that one either, because I think it's pretty self-explanatory. For B, ammonia vaporules, I don't know what that is, and I'm being honest with you, so I'm sorry. I have no idea what that is. It's not something I remember studying or teaching, so I can't really explain that to you, but I think that one was pretty easy. So anyway, so I hope that helped all of you. Please, if you have any questions, please just let me know anytime. And stay tuned for the next video. I had a lot of fun doing this, so I'm thinking I'll post one up in another couple days. But I do say that you should hit subscribe to my YouTube channel so that anytime I post a video, you know. And I'll put it on Facebook too. So if you want to join my Facebook page for Dentalelle Tutoring, go to facebook.com /Dentalelle Tutoring. So easy. Join that page, and I'll put the videos on that page too. So that might be easier for you. But anyway, so I will let you all go, and any questions, please just let me know. And I will see you all soon, and stay tuned for the next video.